So yeah, basically what happens after the balloon sinuplasty is post-operatively, essentially you go home, you can take a little bit of Tylenol if you need to for pain. There's normally not a lot of discomfort with it, so there's no need for anything like a Tylenol with codeine or any major pain medicine. Tylenol is good. If you have to take a little bit of Motrin, it's okay to add some Motrin to it. The other issue is that for the first few nights, we'd like you to sleep sitting upright. Now, it doesn't mean you have to sleep sitting upright. When you sleep sitting upright, it helps the fluid that would otherwise collect, the edema and the swelling that would otherwise collect in the tissues, are going to be more likely to go down, to your heart and to your lower extremities. So it just kind of lowers the pressure in your head, will help get some of the inflammation out of the nose, and help you breathe a little bit easier post-operatively. The other thing that we like people to do is to start doing a saltwater irrigation to the nose 3 times daily. It's with a large volume bottle, and if you may or may not have received one on the day of your procedure. You may have been given like a coupon or a little pamphlet telling you the type of device to buy. They're not very expensive. They're just a few dollars, I think, at Walgreens or CVS. And we'll have you fill that up with a salt packet and or a canning salt. Canning salt is non-iodinated salt, so it's just like a canning salt. You can get it at H-E-B or anything like that. And you can take a tablespoon or a teaspoon, put it in there, fill it up to the top, and just really rinse out your nose very aggressively. We're going to have you do that 3 times a day, probably for several weeks after the procedure. I may or may not ask you to start with the irrigations the morning after the procedure. Other instructions, really, small amount of bleeding is normal. We expect people to have multiple small bleeds, kind of where they're just more or less wiping their nose. If you have sustained bleeding that's very difficult to control, if it lasts for more than 30 to 45 minutes and it's just pouring out, the next thing you can try is to get a little bit of Afrin and spray that in your nose. But I'd like people to use that only sparingly, only if you're having aggressive bleeding, which is rare in these cases. The last thing I'd say about that is that if you're having sustained bleeding and the Afrin doesn't work and you've bled more than a soda can of, like if you cut the lid off of a soda can and you could fill it all the way to the top with bright red blood, that's what you donate when you donate blood. So at that point in time, you would want to think about going to the emergency department to get attention. But again, that's very unusual. That happens maybe 1 out of every 200 to 400 patients or so will have bleeding that's that aggressive. So don't let that scare you too much. Other instructions are if you wear a CPAP at night, go ahead and wear the CPAP. We want you to wear that CPAP. That's going to actually help get the pressure out of there and help improve your breathing. No nose blowing for 5 to 7 days after the procedure. And here's the reason why. When we put the little balloon up to open up the frontal sinus, it fractures the tiny little bones there, and some of those bones are so paper thin that if you blow your nose really hard, you can actually blow air into the eye socket. Now, it won't hurt you, but it'll freak you out because your eye will swell up and it looks crazy, and everyone gets upset about it. And it's just a good idea not to do that. Okay, so if you have something in your nose, it's okay to sniff as hard as you want. You can suck and spit it out all day long, okay? But we don't want you to blow really hard because of that risk of blowing air in there. But that's only for 5 days. After the 5 days, you're able to blow your nose, do whatever you want completely normally. We also try to encourage people against aggressive physical activity or against heavy lifting for 5 to 7 days after the procedure. For the same reason, when you lift something really heavy, you're straining and it creates the pressure that goes up in your head, and that pressure can force the blood vessels open and cause you to bleed. So that's pretty much it. Those are the instructions for balloon sinuplasty. Yeah, really that's it. Thank you.